Good day and welcome to the weekly educational rounds here at Sinclair. My name is Jim Ellermeyer. I'm a behavioral health therapist here, and today I'm joined by my colleague.
I'm Nicole Smolik. I'm a physician assistant student from Marietta College in Ohio, and I'm on my psychiatric rotation here at Sinclair.
And through the magic of technology, we're joined by our colleague, Dr. Ted Civic. Perhaps you could tell us a little bit about yourself, Ted. Share it with the audience.
Sure, be happy to. I'm a doctor of Chinese medicine and a Taoist priest, and we approach treating illnesses and what we call qi deviations from a perspective of classical Chinese medicine, which goes back almost 10,000 years of cumulative and empirical evidence. So it's a little bit of a different approach, but it seems to help a lot of people.
And also, we're joined by our medical director here at Sinclair, Dr. Safdar Chaudhry.
Well, thank you.
We're certainly glad to have you here today. And the subject of today is the untimely and tragic passing of comedian and actor Robin Williams. I've been sitting in with Dr. Chaudhry with a few patients, and more than one of them has brought up the fact of Robin Williams passing, and I'm going to ask Dr. Chaudhry to share a little bit more about that.
Yeah, so part of my ignorance is I don't watch movies or have a lot of awareness of Robin Williams' impact on the everyday cultural norm of our patient psyche. So I kind of came from an angle of just hearing firsthand through them. I don't watch news as well, so I didn't even know that had occurred. So the patients began to talk about that as they would come in for the regular sessions. And there were various, I can just kind of put them together in the blocks of reaction. Those who were still going through depressions of their own would term that they were jealous of that act of suicide, and obviously that was very concerning to me as a clinician. Others were stunned by the fact that it had occurred, because they had not believed that there was a life of agony in the personal domain of Robin Williams, who appeared to not have such agony in his life. So those were the second reactions. And the thirds were a lot of sorrow and almost like a little blame, and saying that why did not people pick up on his depression and other difficulties. And I would say I will tie into that the observation of our cultural living, and most people were saying having money does not guarantee peacefulness and happiness, and how he may have struggled with his depressions and interpersonal agonies on the face of performing for others, and so those were some of those things, and I wanting to understand this whole thing. Those were the major, but I was stunned by the number of people who wanted to talk about that, and it made me realize how ignorant I was about the impact of, the norm of, I would say movies and things which have play a role in our everyday living.
Absolutely, and I think most people were well aware of Robin Williams' struggles with drugs and alcohol. Perhaps you can chime in on this, Ted. I don't believe as many people were aware that he had some serious issues with depression.
Well, first, I've been a big fan of Robin Williams for a really long time. I mean, his ability to just go off on a tangent was unprecedented. He had, in my estimation, I've never met the man, but it just seems from his television and radio broadcast that he was so incredibly quick and gifted in the ability to just run with concepts and ideas that it occurred to me that he might be struggling when I first heard him, almost like a bipolar in a way. I'm not offering any diagnosis or whatever, but for someone to be able to go that quickly off onto a tangent, I was imagining that there has to be those equally times of low and despair and going into the darkness. There has to be some kind of balance, I guess. And, he made billions of people laugh. And I read a couple things about him, that was his purpose in life. That's what he really wanted to give to this world, that he really wanted to make everyone smile and laugh and break free of their own chains. And he certainly did that, at least in my humble opinion. I mean, he really broke me up, and I know he really broke up a lot of people, but you know, I can only imagine what that was like, being alone with that mind at night when he would come crashing down.
Dr. Chaudhary is a addictionologist, a board-certified addictionologist, and I'd like to hear your thoughts on the correlation between substance use and depression.
Yeah. Before I do that, I do want to kind of follow up on Ted's comments of the personal life of a comedian, and I really don't want to generalize that, but I at least want to. It just occurred to me that in my earlier years of life, I did watch movies and watch news and everything, and there was a comedian in Pakistan who was very well respected and known and liked and there, and he also committed suicide, and I didn't even connect that dot. And as I kind of look back, how we may have our own struggles, and we may use this sense of humor to manage that, and then use the same giftedness for others who we may relate to, who may be struggling in their life. So he may have kind of, I mean, as not trying to overanalyze, but may have struggled with his own agonies, and then used humor as a tool and a very healthy tool to balance out those agonies, and may have used that for others who he could relate to, who may be struggling in their personal lives. So with that said, addictions and depressions are very well nicely connected. We all are addicts of some sort or not, but there are addictions which can be healthy, and there are addictions which can be harmful. And so addictions are a good thing, because addictions are desires to have something in our life. So as we quantify them in the world that we live in, we use the methodologies of addictions of drugs and alcohol. But behind that, there's an individual who is struggling with something. I mean, outside of the recreational use and then getting biologically dependent, I think most people who continue to use are doing something at their brain level to feel okay.
And Nicole, you're doing your psychiatric rotation here at Sinclair as part of your wrap-up to your education as a physician's assistant. Do you have any comments, any observations on Robin Williams?
I mean, I grew up with him as a child. You know, he's been in a lot of movies and everything, and I mean, it's hard to believe that someone who always seemed so happy and so, upbeat felt that he needed to commit suicide. But it just goes to show you that a lot of people have intrapersonal problems that they don't show on the outside. So, just being on this psychiatric rotation, even, a lot of people coming in are people that you'd probably see on a day-to-day basis, and they wouldn't seem like they were having any issues, and then they come here and it's a completely different person. They open up a whole new side of themselves. So it just goes to show you that anybody could have this problem, even people who are, considered famous in the public eye.
Absolutely, and I think that's, if anything, if it will serve a purpose, it will serve the purpose of awareness. Yes, we can be strong and seamless, but we may also have a vulnerability of our living, and then being open to that vulnerability is actually a very noble thing that makes the awareness of strengths are built on vulnerabilities, and we are all stronger by having both of those things in our lives and being okay with that.
Ted, one of the impacts of the media and their constant need to have new stories, new varieties to throw at us, is that the attention span of the American public seems to be getting less and less. And we tend to have what I call quick forgetters. So what can we do as mental health professionals to get this message out there and help people to understand that there is help?
What was the question? I'm sorry. No, I'm just kidding. This is such a serious topic. We had to have a little lightness in it.
Absolutely.
I don't know. I really, that may be true. I really am not aware. I know that we want instant gratification very quickly anymore, from our Twitter accounts to, our likes on Facebook to, texting and everything. The world definitely is changing, and I do believe that along with that change, so does our mental awareness and our capacities for patience and our ability to extend that patience and to be a little bit more patient with people. And maybe that's what we're really saying. One of the things that really, I think, with the media, it has brought attention to the severity of suicide. And the World Health Organization has recently come out with a statement talking about over 800,000 people each year take their own lives, and that's about one person every 40 seconds. So it's obviously a very severe action that's going on around the world. And they also come out with something really startling, that they said that 3 times as many men die of suicide as women in males over the age of 50 in higher income countries. So Robin Williams definitely fits into that profile. And so, we're looking at this, it's information, but it really, I think, of all the things that the media are doing, is bringing attention to something that really did not want to be talked about for a very long time.
Well, I'm going to ask Dr. Chaudhry to comment on what can family members, what can loved ones observe when a person is not just experiencing a blue day, a sad day.
Yeah. So it really is important that we take comments or observed behavior seriously. It's better to be on the error side of cautious than not. So whenever anyone makes the comments of not wanting to live anymore, it should not be just seen as a attention getter. It should be seen as a way of, even if it's an attention getter, it still is a serious matter. But avoidance, increasing isolation, changing a person's vibrancy and being more subdued and not being alive. I would say sometimes people are living, but they really are not living. As Ted would say, the chi is taken out of them. And then being able to see that as an observational behavior is very important. And then really it doesn't require always a psychiatrist to do a lot of fun things. Begin to have a family that comes together and begins to be more playful and more joyful, and also seeing what's going through people's hearts and just being able to observe and being able to share those things. In the olden days, people just didn't go out and run to the hospitals or to the pharmacies. They came together as communities, and there's so much of richness in that perspective. So if there is something which is not resolved after understanding with open communication and open understanding, then getting professional help is warranted, and so that a professional can advise as to how to be able to guide through serious conditions and disorders. But in my opinion, there's a lot more lifestyle issues which become difficulties in the modern times than there are diseases which are prevalent.
And here at Sinclair, we don't label a person as a depressed. Every human being that comes into Sinclair is worthy of dignity and respect. And it may be a human being with a pure light burning within them who happens to be dealing with an issue related to depression or anxiety or the other things that drive people here. However, what Dr. Chaudhry's plan is an holistic treatment plan where we look at every aspect of a person's life, their social interaction, their nutritional habits, their sleeping habits, their exercise, and Dr. Chaudhry feels that unless we address every aspect of a person's life, we'd be doing them a great disservice.
I agree. It's all a chi, right, Ted?
Yes, very much so.
It's all a chi. So we are privileged to be in that capacity of being able to provide certain guidance, but really is not with the interest of saying that we know it all, and that's why we collaborate at Sinclair with all various healers in town. An example is obviously Ted being a healer within the Chinese medicine. So are the healers which are neutral pharmacy kind of healers, they give people advice how to use the natural thing. My role is to really, obviously, when a person is stuck, to unglue them from from their difficulties so that they can begin to glow and flow again within the allopathic model of medical sciences, using treatments which can be helpful.
Could you possibly share with folks, Ted, how they could contact you?
They can either contact me through Seclair, or they can go to my website, which is www.inner-strength.com. Hope you like the name. And or they can call us here at 724-845-1041.
And I'm going to ask Nicole to let everyone know how they can reach this podcast and reach us here at Seclair, which I consider just absolute magic.
To continue the conversation, please like us on Facebook, plus us on Google+, or follow us on Twitter under Seclair Life, and keep an eye out for any of these for our next live recording Mondays around noon to ask any of your own questions. And you can also find this and other ground rounds on youtube.com/Seclair video, and find audio versions on iTunes, Stitcher, Spreaker, and iHeartRadio. Please visit us at www.seclair.com for more about us and other articles on our great blog.
And as always, we leave you with a prescription. One that Dr. Chaudhry writes frequently every day: fruits, nuts, and vegetables. Perhaps unplug your television. Maybe take up fishing. And for a truly mindful experience, fish without bait. And be good to yourself.
Thank you.